Hello everyone, I'm Dr. Angela Mattke and you are watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center in Rochester, Minnesota. Twice a month I host a show about pediatric health topics where we take and answer your questions live. May is Mental Health Awareness Month and this week is Children's Mental Health Awareness Week. Anxiety disorders are the most common mental health illnesses among children in the United States and also our focus today. We will be discussing how to recognize anxiety and help your child get the appropriate treatment. Joining us for the discussion today is Dr. Stephen Whiteside, a clinical psychologist and expert in the treatment of pediatric anxiety disorders and OCD. Dr. Whiteside is a professor of psychology at Mayo Clinic and the director of the Pediatric Anxiety Disorders Clinic. Please send your questions under the Facebook Live video feed and we will try our best to get to them during our live video broadcast. Dr. Whiteside, thank you so much for joining us today.
Thank you for having me. It's my pleasure.
This is a really pervasive problem that we see, both of us in our practices, a lot, and this affects a lot of children throughout the United States and the world, right?
Yes.
Yeah. So how did you get interested in anxiety disorders in children?
Oh, that's a good question.
Yeah.
That probably a number of factors.
Yeah.
One of the mentors I worked with when I was doing my fellowship here was an expert in anxiety disorders. I'm also a little shy and anxious myself, so it maybe came naturally to me.
Yeah.
And it's also a treatment that really works. So anxiety can really get in the way of kids' lives, and it can cause a lot of suffering. But if you give them the right treatment, they can really blossom and feel a lot better. So that's rewarding.
Yeah, you and I were talking just before the show about how satisfying it can be when patients can get this treatment, and it really changes their life.
Yeah.
You know, they can go out to do things that they weren't able to do before. Okay, so let's dive in to talk a little bit more about anxiety disorders. So what does anxiety look like in children?
Yeah. So, anxiety disorders cover a number of different fears and worries. And we have a number of different diagnoses and labels for them that mostly just kind of focus on what the child's afraid of.
Okay.
So kids who are afraid of being away from their parent, separation anxiety disorder. Kids who are overly shy or social anxiety disorder. And so anxiety disorders look a lot like they do in adults, that kids feel very nervous in a situation, and parents often pick up on it because they try to avoid. And when kids try to avoid, often they will get sad or scared and cry or get angry sometimes to resist. And so parents usually come in when it's causing a problem with life. So going to school is a big ordeal because the child's very nervous about going and resists going. Or whenever the family tries to do a new activity like join soccer or dance, the child gets very upset and resists going. And after they go, they have a good time, but the next time it's time to go, they get upset again.
We have a nice diagram that kind of describes this. Can you walk us through that cycle of fear?
Sure. So this is one of the pieces of material we use to help families understand how anxiety disorders work. We use an example of fear of dogs because that's a pretty common fear. It's pretty straightforward, concrete, easy to understand, whereas other fears like general worry or obsessive compulsive disorder are less intuitive and they're harder to understand, but they all work the same. So in the diagram we have here, this is how a fear of dogs works. So starting at the top and going around clockwise, the boy sees the dog and then he reacts. So he starts to think this dog's going to bite me and he gets scared. No one likes to feel scared, so he runs away. And after he gets away, he feels a lot better. He feels relaxed, relieved, but because he continues to believe that dogs are dangerous, the next time he sees a dog, the whole thing repeats itself. The three things that we really want parents to recognize here is it's not the dog that makes him nervous, but his expectation that's going to bite him. So if we can help him change his beliefs, then he would feel less anxious. But we can't just talk ourselves out of things that we believe, because our beliefs are based on our experience, and then we talk about the importance of avoidance. So if the boy always runs away from dogs, never spends time with dogs, he never has a chance to learn that they're not so bad. And so finally, we talked about how that's a very normal reaction because none of us like to feel anxious. So running away, if it makes us feel better, it's automatically reinforced or rewarded. So we're likely to do it again and do it more. Not only big dogs, but small dogs. Avoid situations that there might be dogs. It's a quick way to feel better.
Yeah, absolutely. How early can you start to see some of these symptoms of anxiety in children?
Well, most things, anxiety included, some parts of it are inherited. So some of us have dispositions to be more anxious than others, and those can really be present from the beginning. Kids that are just more reactive and they get anxious in situations, and when they get anxious, they have a much bigger emotional reaction than other kids do. Typically, the kids that come in to see us are school-aged, so around elementary school, kindergarten, throughout teenage years. Early on, the fears that we see are mostly separation anxiety. So when the kids start to go to preschool or kindergarten, they have difficulty separating, or when we start to see kids.
Mm-hmm. How about some of like the kind of more typical development anxiety we see in kids? Like when is separation anxiety become a problem as opposed to kind of a normal developmental milestone we see with kids with their social emotional development?
Yeah. The answer to that really comes down to impairment. How much of a problem does it cause?
Okay.
And that varies by family. Some families are pretty tolerant, and for their schedule or what they're used to, a certain amount of anxiety around social situations or new activities or separation isn't a problem. Whereas for other families, they have a much lower threshold for when that gets in the way. So if it's distressing to parents and kids, because every day we try to go to school, it takes 5 minutes to peel them off your legs, then that's a problem that we probably should talk about. Whereas, beginning of school year, there's a couple weeks of increased tears, but then the child's able to move on and settle in, it's probably not problematic.
Okay. What about, we say they're pretty common anxiety disorders in kids, but how common are they in children, and does it change the frequency or that we see them in teenage years?
So the estimates vary. Probably a reasonable estimate is somewhere between 10 to 15% of kids have an anxiety disorder. If you are more specific that the problems with anxiety get in the way of life significantly, then that percentage drops.
Okay.
Some estimates are as high as 20% of kids having trouble with anxiety. And that includes all anxiety disorders together, so specific phobias, social anxiety, general worry.
Okay.
The presentation of anxiety tends to change over childhood as kids grow older. Younger kids are more likely to have separation anxiety because it's a pretty typical experience, and for kids that are more anxious, they have more extreme social or separation anxiety. Specific phobias of animals and bugs are also more prominent in younger kids. Once they start to get into middle school and more teenage years, they start peer relationships start to be much more important. So the anxiety starts to attach to social interaction. So extreme shyness, social phobia becomes more prevalent. And then when kids get older and they start to worry more about achievement in school and the future, generalized anxiety becomes more of an issue.
Okay. What does generalized anxiety look like in a child?
So generalized anxiety disorder is kids who worry a lot about many different topics. So they worry most days, and when they have those worries, it's hard to stop worrying. And frequently when adults or kids worry a lot, it affects the way they feel. So they're irritable more often because they're feeling stressed out about their worries. It's hard to sleep. They just feel more jumpy, and it's easier to startle. It's hard to sit down and kind of relax. And so with kids, things that parents can look for are lots of what-if questions. So the family's going on a vacation, and it's a kind of a fun activity that they're going to do, but the child's immediately worried, well, what if we miss the flight? Or what if this happens? What if we don't like where we're going to be? Kids who are doing well at something but worry about it anyway. So kids who tend to get good grades but are still worried about getting their work done on time, even though it's not due for a few days, or worried that maybe they didn't get an A. So worrying when they don't have to.
Sometimes people will term that as perfectionism. Is perfectionism a form of an anxiety disorder, or does it sometimes just go along with it?
Perfectionism can be both, I think, and that's a good question. Sometimes it's clearly anxiety. So some kids are perfectionistic because they're afraid if they don't get straight A's, or if they don't do really well, or if they ever get in trouble, that would be terrible, and that they are not going to get into school, or people are going to be angry at them. Other people are perfectionistic because it's more comfortable for them. They want straight A's, and they're not nervous that they're not going to get them. They just are not living up to their expectations, and it makes them irritable or angry or upset because they haven't met the standards that they've set for themselves. So perfectionism can go both ways.
Okay. Yeah. You talked about a couple different types of the anxiety disorders already. So phobias, social anxiety, generalized anxiety. Are there any others that you see in children of different types of anxiety disorders?
So we see a lot of kids with obsessive compulsive disorder, which is not technically an anxiety disorder anymore, but often includes fear or worry, such as kids who are afraid of germs from public surfaces. If they touch a doorknob, they have to wash their hands over and over again. Other kids who feel nervous about things being not just right, so have to rearrange and tap and touch things over and over again. So we see many kids, and we treat them the same. Social anxiety, separation anxiety, generalized anxiety, specific phobias are the main ones. Sometimes another anxiety disorder is panic attacks. So kids who have intense anxiety episodes that come out of the blue. So they're not set off by being away from their parents or social situations. They don't really know why they have them. And it's that anxiety attack itself is frightening, and they're worried about having them again. That doesn't happen that often in kids. Starts to happen in adolescence and is more common in adults.
Okay. What about post-traumatic stress disorder? Is that considered an anxiety disorder, or is that going to be something different?
Post-traumatic stress disorder, like OCD, used to be an anxiety disorder, and now it's in a category of its own. But frequently, PTSD has a lot of anxiety because something very frightening, traumatic has happened, and the child continues to feel nervous about it. So they have flashbacks or memories that when they have them are overwhelming and very frightening. They avoid situations that are safe now, but remind them of what happened in the past.
We have you talked about OCD, and we have a great audience question. It says, could OCD in a teen translate to an additional kind of anxiety problems or anxiety disorders in adulthood? Do you see those kind of co-occurring?
Yeah, that's a great question. Anxiety disorders in general tend to co-occur. If you have one anxiety disorder, you probably have another, and that's probably kind of relates to the way we describe them and diagnose them. And then OCD also fits in there, that if kids who have OCD often have other anxiety disorders. Most adults that have anxiety disorders, I think the estimate's about 80%, had OCD as a child, so OCD tends to persist. Many anxiety disorders persist. So if you have anxiety as a child or OCD, you're at risk for continuing to have problems with it as an adult, although by no means does everyone who have anxiety continue to have them.
Right, and we'll get to the interventions and treatments that we can do in a little bit. You mentioned a couple things about what causes anxiety. You talked about genetics. Is there anything else that we think contributes to anxiety and to the development of it in children?
So like most things, there's genetics and there's the environment, so nature and nurture. When we talked earlier about that cycle for how anxiety disorders work, there's two things maybe three things in the environment that really contribute to anxiety. One is stressful situations, sometimes, especially with post-traumatic stress disorder. Something happens and it makes the child nervous, and then they start to avoid. So rather than kind of going back and spending time with dogs and learning that dogs are generally safe, after that scary incident with the dog, they avoid them, and that anxiety grows over time. So stressful situations can cause anxiety or contribute to anxiety. A general pattern of avoiding things that make you nervous over time can contribute to anxiety. There's been a lot of research on whether, to what degree parents contribute to anxiety disorders, and probably the fairest way to look at that is that really hasn't panned out. So the good news is we never blame parents for kids being anxious.
It's important.
Which will be important when my daughter grows up and is anxious.
Same with mine.
But one thing that parents do tend to do is that can contribute to anxiety is be over-controlling. Which probably in many cases may be a result of their child being anxious. They realize that to just make life go smoothly, they've got to kind of control things. But it also prevents kids from having those experiences that teach them it's okay to fail and it's okay for things not to go well. I can handle it. If they don't have those experiences, they don't learn that.
That really gets into a lot of that resiliency building, right? And why that's important. Do you talk a lot to parents about how to let their kids fail and to experience kind of those uncomfortable emotions and learn to tolerate them? Yeah,
everything we do, we include parents because we'll talk more about treating anxiety in a moment, but you can't just do things in a therapy session. You have to make changes between appointments, and that's hard for any of us to do, particularly kids. So we want parents to be aware of the changes their kids need to make and help them. And parents change, so that we try to reassure parents that it's not their job to make sure their child feels happy and feels good at every moment of the day. It's their job to let their child experience life and learn to become resilient. And that's hard because we always want to fix things. It feels good to fix things for your child, and when they feel nervous, you feel upset, and that's hard for us to handle. So we include parents so that they can kind of learn that they can handle that with us.
Absolutely. How do you go about making this diagnosis, and really who should be involved in the process? Is this a primary care thing? Is this something that should be done really by a psychologist or a clinical psychologist? Tell us about that.
Yeah, so the primary care physicians and providers have a very important role in all mental health issues because that's where people go. Pretty much most people have a pediatrician or a family practice doctor that they work with, and that's who they trust with their child's health. So that's where they go. So it's very natural for people to go to their family doctor first. Diagnosing an anxiety disorder is the things to keep in mind are we want to make sure that the child is overly anxious about what they're experiencing. Mm-hmm. So for a child who's getting pretty good grades but worries about them, despite that, for a child who gets along pretty well with kids, they're generally well liked, but they're very shy about making mistakes. Those are anxiety disorders. Mm-hmm. Whereas a kid who is failing a couple classes and is really struggling in school and is worried about that, that's a problem with school, not with anxiety. Or a kid who's being bullied or teased a lot and feel nervous about being around kids, that's a problem with being mistreated by other kids, not an anxiety problem. So that's probably the most important piece to get right. Okay. Is this child overly anxious about a typical situation, or is their anxiety developmentally appropriate? Because we'd all be anxious in that situation. So kind of it's first identified by physicians often, and then it's helpful to have a mental health specialist, whether it be a psychologist or a psychiatrist or a social worker, someone who has an expertise in anxiety to make that diagnosis. Kids need to be part of that evaluation because they're the experts on how they feel, but parents have a very important role in providing information, not just about how the child's feeling recently, but kind of what have things been like over time, so that we can get an accurate sense of kind of what the kid's been like and what their experience has been like.
So you've made the diagnosis. What are the treatment options, and what's really most effective? What is the literature and the research that you've done a lot tell us about how to treat kids?
Yeah. So the most important and probably the most effective treatment is exposure therapy. So helping kids face their fears and learning through their own experience that what I was afraid of probably is not going to happen. And even if things don't go well, I can handle it, and I can handle these uncomfortable feelings of being scared and nervous. That's not something parents can tell their kids when they have an anxiety disorder. We can't just tell people that and they magically believe that. Kids and adults need to learn that through their own experience, and exposure therapy is helping them do experiments to learn that. We
have a nice diagram of that. Do you want to walk through that?
Yeah, let's go through that. So here we have that same example of a boy who's afraid of dogs, and it starts same place up at the top, and we're going around clockwise. So the same boy sees the same dog and the same reaction. Dog's going to bite me. I can't handle this, feeling scared. But this time, rather than avoiding, running away, he stays with the dog, he pets the dog, he faces his fears, he does what we call an exposure. He exposes himself to what he's nervous about. And because what we're asking him to do is relatively safe, it's something people do every day, it goes relatively well, and he starts to have a new thought. Hey, dogs aren't so bad, I think I can handle this. Starts to feel better, and that makes it easier to go up to the next dog. We emphasized two really important things about this cycle for families. Number one is that the first thing that changes is his behavior. He's still feeling nervous. He's still worried something bad is going to happen, but he faces his fears despite that. It would be a lot easier, and I'd be a lot more popular if we could just turn off our feelings and thoughts like a light switch, but we can't. We can't control our thoughts and feelings, but we can control our actions. Fortunately, after you change your behavior, your thoughts and feelings start to change with it. The second point is that this is not a one-time thing. He can't just pet one dog. Right. Hey, I'm over that. That was pretty good. He has to pet many dogs in many places until he learns he can handle most dogs most of the time. And that takes hard work. It takes patience and persistence.
And a lot of support probably from parents in this process, right?
Yes.
So we typically think that therapy then is going to be the most effective treatment for anxiety disorders in children. Is that correct?
Yeah, so a lot more research needs to be done to really understand what the most effective and efficient and safe treatments are. There is a lot of research. There are close to 100, if not more, studies looking at cognitive behavioral therapy, which involves exposure therapy, and showing that that's more effective than not doing any treatment. Within cognitive behavioral therapy, there's more and more research suggesting that it's exposures that are most important. And many people many families, many kids are taught relaxation strategies, thought distraction, and things like that, which make you feel better in the moment, but don't really sufficiently treat anxiety. So exposure therapy is probably the best treatment that we have. Medications are another option. In our clinic, we always like to start with exposure therapy because we think that's the safest treatment, and it's one that can be time limited, and you can learn strategies, and you can use those after you're done with treatment. And if we don't have enough success with exposure therapy, then we have them evaluated by one of our psychiatrists to see if medication might be appropriate as a second line treatment.
I think that's a really important message for parents to hear, because sometimes they don't want their kid to go on medications, and I've had parents say they've been reluctant to bring them in because they're afraid we're just going to put them on a medication. But if we're really trying to treat the root cause of the anxiety, the therapy is going to be helpful.
Yes.
And you've done some extensive research looking at all these studies together. Is that correct? And they've shown that there is a positive benefit if we were to do nothing.
Yes.
Okay.
Oh, yeah. Clearly, it's very clear that therapy is going to help more than doing anything, than doing nothing. And exposure therapy, helping children face their fears, is probably going to be even more effective than other types of therapy. The challenge, and it's a very real concern from parents' standpoint, is that, first of all, there's limited mental health resources, and the number of therapists who actually do exposure therapy is even smaller than that. And so when families go in, medication may be the most accessible treatment option.
So what about parents and schools? What can they do to kind of help their children navigate this process, especially during therapy?
So identification is the first piece. Most kids with anxiety disorders don't get any treatment. So some estimates are about a third of kids with an anxiety disorder are identified and get treatment. So identification and bringing kids in for help, that's probably the most important step, and parents can play a role in that, and schools can play a role in that as well. Unfortunately, advocating for treatment is probably going to be a big piece, or advocating for the right treatment. Parents understanding and learning that that therapy is a valuable option, exposure therapy is necessary, and they're probably going to have to talk to the therapists and say, I've been reading about this exposure therapy. Is this something you do? And if not, can you help me find someone who does, or can we kind of learn this together? There are a number of good resources out there. We have an intensive treatment program designed specifically for people who can't find therapy in their home areas, where we've tried to take our exposure therapy program and collapse it into 5 days, so families can come and spend a week with us facing their fears, and then go home and continue it after they leave.
Absolutely. We had a great question that came in about parents and schools and how they can work together, but they wanted to know if there's any specific tools that schools could use, maybe getting at school-based mental health specialists and stuff. Has that been something that's been successful in the treatment for children that have anxiety disorders?
I think exposure therapy or therapy in general, and exposure therapy is, it takes specialized knowledge, but it's not overly complicated or overly difficult, and especially for someone who has a mental health background, it's something that they can learn to do. So there's definitely a role. Many kids, obviously most kids go to school, and that's one of the most common places that they receive mental health services. So schools can play a large role, particularly with social anxiety or school-based anxiety, because that happens in the school. That's where a lot of kids' social interactions are. So if there's a counselor, a school psychologist, or a social worker who can help families do exposure therapy in the school, or kind of be communicate to the parents that the child is working on their goals during the school, can be very helpful.
What about the role for 504s and IEPs in helping maybe accommodate the learning environment for children that have anxiety disorders? Is that beneficial to them, or could that be more harmful if they're avoiding some of these things that cause the anxiety?
That can go both ways.
Okay.
So IEPs and 504 plans that accurately identify a child as having an anxiety disorder and saying our goal is to have this child return to all normal functioning, but they're going to need some time because they're going to have to face their fears and build their confidence, is wonderful. Kids who are doing their best and parents who are getting as much treatment as they can, but there's still anxiety is causing some difficulties, 504 plans IEPs can be appropriate there as well. And the other piece is when anxiety is more a reaction to stress. So a child has a learning difficulty or attention problems, and those are causing anxiety. A 504 plan that addresses the root cause of the anxiety and the fears and the worries in that situation can be very important.
Absolutely. A lot of times parents ask what they can do to help. Is there any tips that you would tell them what they should do, or maybe really what they shouldn't do in these situations?
Yeah. Most importantly is to be warm and supportive of kids. It can be really stressful when your child has anxiety, because you have your hopes and dreams for them, and you also have the daily tasks you have to get done. And if your child, if just going to school or getting dressed causes a lot of anxiety, that's really stressful. And when we get frustrated and angry, our kids get more upset and everything blows up. So doing your best to stay calm, being warm, supportive is the first thing. Secondly, realizing that there are things that can be done to help, and getting your kids help is probably the second piece. And also realizing that anything you can do to help your child in a warm, supportive way face their fears, experience life, not avoid, is going to be helpful. That's easier said than done when kids have full-blown anxiety disorders because they can really push back, and that's hard to handle on your own as a parent.
Okay. We had one other audience question that kind of, I think, gets at the root of this. How young can you start to do exposure therapies? This question was about separation anxiety disorder in toddlers. How early are you able to help children that are quite young with separation anxiety?
Yeah, that's a great question. The principles of anxiety disorder treatment are the same across the lifespan, but the way we implement that varies a lot. With the younger children are, the more parents need to be involved. So a teenager can be pretty self-sufficient in doing their own exposures, but they need a parent to make sure they're staying on task. For very young kids, for toddlers, and there has been research on how to treat anxiety in very young kids. It involves a lot of helping with parents use kind of general parenting strategies, attention, paying attention to brave behavior, removing attention from anxious behavior, having behavior management strategies to help kids face their fears in the situation, help them kind of manage their emotional reactions more. So the principles are the same, but it's much more focused on teaching parents to support their kids through it when it comes up.
That makes absolute sense, thinking about their development. So well, we're almost at the end of our time here. Are there any resources that you would recommend to families as they go through this process?
Yeah, there are a couple of websites for professional organization. The Association for Behavioral and Cognitive Therapies, abct.org, and I should have thought of this beforehand.
That's okay. We can put it up on the screen later.
ADAA are both two professional organizations that you can search for a therapist in your home area.
So people that have like explicit training in these areas or specific training?
Yeah. Okay. The International OCD Foundation similarly focuses on OCD, and they have you can search for a therapist in your home area.
Oh, fantastic.
We have a 5-day intensive treatment program that's designed for people across the country whose children's anxiety is enough that they want to get help and they can't find help closer to home. Those would be the main resources I would start with.
Absolutely. And what's the number if they wanted to contact our place to set up that 5-day intensive appointment?
I think we have that on the
We do have it on the screen.
There.
So it would be Mayo Kid. So 855 Mayo Kid would be the number to call if you did want to set up an appointment. They don't need an external provider to make a referral for this program. Is that correct?
Yes.
Okay, fantastic. So you can self-refer, which I think is a nice feature. So, well, that is all the time we have. Thank you so much for joining us and sharing all your knowledge about this.
Thank you for having me. I enjoyed it.
Yeah, it was fantastic. We'll have to have you come back again and talk about some other anxiety-related concerns. So,
sounds great.
Thank you, everyone who joined, and thank you, everyone who sent in questions today. Catch the next Ask the Mayo Mom on Facebook Live on May 17th at 11 a.m. Dr. Peter Ree, a hand surgeon at Mayo Clinic, will be joining us to talk about enhancing upper limb function in spinal and brain cord injured patients. Thanks, everyone, and have a wonderful day.